It's like, doctor, is it true that anxiety medications will make me addicted to it? Well, this is true to some extent. There are some anxiety medications that people get addicted to, and because anxiety is so scary for someone, they always want these medications to control their stress or anxiety. But there are newer drugs now, there are newer medications that do not make you addicted, and they are just as effective, but you have to go to a psychiatrist or your physician to come to know what those are and if you really need them. A lot of people are so scared of the side effects of medications that they would rather accept the disease. And that's a little strange, right? Because the disease can do more damage. Whatever tablets or medications you take, their side effects are often very rare and they can be easily controlled. Like this question asked, amoxicillin antibiotic causes loose motions. That's why I don't take any antibiotics ever. See, not all antibiotics will have side effects, and not everyone has these side effects. And the reason why these side effects have been listed is so that, when you have those, you can change the medication or you can control the dosage. All right, but it doesn't mean everyone has it, and sometimes these side effects are a little better compared to the effects of the disease. So let your doctor take that call, what we can expect from you is to be compliant, and if you do not like a medication because of its side effects, there are always alternatives that your physician can help you with. There's a lot of tuberculosis in India. It's actually a national program, and there has been announcements from the government that we will be tuberculosis free in the year 2025. But this question comes a lot: do tuberculosis medications cause permanent hearing loss? And which is true. One of the medications, streptomycin, that is effective for tuberculosis, can injure your inner hearing hair cells and cause permanent hearing loss. And that's why there are newer regimens. So when you go to your physician, they will give you the right dosage and the right combination of these medications so that you do not have hearing loss. And sometimes a lot of follow-up is also needed. Some early signs, if you can detect, get hearing tests, then the doctors can quickly change these medications. So follow-up is just as important as taking your medicines. Every now and then when there is this dengue outbreak, ये वाला क्वेश्चन हर जगह आ जाता है, रेडियो पे, डॉक्टर्स के पास, डॉक्टर पपाया खाएंगे तो डेंगू इन्फेक्शन प्रिवेंट होगा क्या? See, what papaya does is it just helps build your platelet counts. It cannot stop the mosquito from injecting the dengue virus into you. So while you may have a little more platelet counts or probably a better ability to defend yourself, but it cannot prevent an entire dengue infection. So do take papayas, they're good for your health, but don't assume that now you're immune to the entire dengue infection. Now as we get older, we start forgetting things. तो ऐसे सवाल भी आते हैं, Doctor, I forget taking the dose of a medication, so should I take 2 pills to compensate for the lost one? As a rule of thumb, अगर आप कभी भी कोई भी दवाई का डोज भूल जाते हैं, तो आप सिर्फ वही डोज लीजिए and just continue with it. Do not overdose yourself, because sometimes overdose can have its own harmful side effects. If you have missed 1 dose or 2, most of the time that is fine. Just continue with your course and go ahead with it. So guys, these were a lot of questions. Some were weird, some were reasonable. But what's most important is ask these questions, because that's very important for your health. But ask these questions to the right people. Go to a platform like Practo, where there are a lot of qualified doctors who in a click of a button will be able to answer all your queries, whether they're weird or whether they're reasonable. Don't worry about that. What's important is that you're questioning about your health, you're monitoring it, and that's very important for you to stay safe. Thank you very much for watching this video, and if you liked it, please like, share and subscribe to this channel, and stay tuned for more such videos on Practo.